Well, I think without delay, we should start, and I would welcome all the audience here. Very welcome. Again, I'm Suraj. I'm a microbiologist. I work in Oxford, and I'm really pleased to host the second webinar for Phage Arabs consecutively. And it was really interesting, the last webinar, and I'm really excited to take this webinar further. So without delay, I would welcome and request Chris Shaffer, who is our first keynote speaker, and the presentation, the topic of the topic would be phage therapy journey and the phage one voice, and I'm the big fan of him. So I'll hand over this stage to him, and we'll be really keen to have insights from him. Over to you, Chris.
Well, thank you very much. I want to thank you for inviting me to be part of this. This is a very important speaking series that you guys are hosting. I want to tell my story, but my story is still emerging. It is not a story that has finished yet, for sure. It is just unfolding as we speak today. My life before this infection looked like this. I grew up in a place called Springfield, Ohio. My parents owned an auto body shop. We were just regular people. I was a music teacher. I was a special education teacher and a high school principal for most of my career. I was really dedicated to that. I really loved the work that I did. It was fun. It was exciting. And until it wasn't. 45 years into my career, this happened. I thought that I had COVID when I woke up one morning. It was 2021 and it was April of 2021. And I had avoided COVID for quite a while, it seemed like, but I came down with what appeared to be the worst flu I've ever had in my life. And I was just sure that it was COVID. And so I drugged myself out of bed. Rather than taking that nose swab, I went down to the site where they do PCR testing in my city. And I had that done. And then I went back to bed, drugged myself back to bed because I was really, really sick. And then I went to sleep that evening, woke up the next morning, and I was even sicker than I was before. And I woke up with, my hands were numb. And I thought, this is just not right. Something's really wrong here. So I called my primary care physician, explained all the symptoms to him. And he said, is there any other symptoms you haven't told me about? I said, well, you know, up until this started happening, I was having a problem urinating. And he stopped the conversation cold right at that point. He said, whoa, wait a second. This sounds like bacterial prostatitis. You need to hang up the phone and get to the hospital immediately. And I was really pretty nervous upon hearing that. And that's what I did, though. I got myself to the hospital immediately. And about the time I got to the hospital, my PCR test results came back and it was negative for COVID. So I knew something was really bad. And thankfully, I had taken some urine tests and some blood tests just a few days before this, just as routine. Yearly, we do that. And they came back positive for E. coli with ESBL. And so at the hospital, they filled me full of antibiotics, and I did start to get better. But, you know, fast forward about 6 more weeks, I was back to the gym. Life was normal again. Except then about 6 weeks on, I started to feel sick again. All the same symptoms came back. I called the doctors and they said, well, it sounds like you have the E. coli again. Well, it never left. It was still there. And sure enough, got the testing, I had it again. And they filled me full of more antibiotics. This time it was a 12-week round instead of a 6-week round. And this began years of antibiotic therapy, this yo-yo of on again, off again, serious side effects with the antibiotics. It gave me a purpura-like condition where it looked like I'd been beaten with a bag of nickels. I had bruises all over my body, daily fevers. My quality of life just literally collapsed. The doctors would tell me that when this antibiotic you're on fails, and that really caught my attention. When it fails, not if, but when. When it fails, you will have to go into the hospital for a 35-day round of IV drip antibiotics. That sounded really horrifying to me. And I asked them, is this going to cure me or is it going to make me better? Well, they couldn't tell me that answer. And well, it might also harm you. That's why you have to be into the hospital. And I was at a dead end. I felt like I was at a dead end. I needed to start doing research. And that's really what I poured myself into, rather than sit back and wait for this thing to kill me, because I felt like that's what was going to happen. You can't live under this kind of condition where you're constantly sick. I ultimately had to quit working for about 6 months because I just couldn't do it anymore. I was too sick all of the time. And I started learning everything I could about this infection. I learned about why antibiotics fail. It's very difficult to get an antibiotic into a dense organ like the prostate. And add on to that biofilms, right? I knew it was never going to work once I learned about this kind of thing. I learned about bacteriophages and what they were, how lytic phages work, the precision targeting. It's not a shotgun like antibiotics. It's a laser focused treatment. And it seemed like everything I was reading, everything I was studying, this would work. I couldn't get anybody to talk to me though. I didn't know anybody. Remember, this was 5 years ago, just about 5 years ago when this all started happening. There really wasn't as much information out there like there is now. There's more now, and there's people talking like myself about what's going on. I learned about this phage antibiotic synergy. It's a powerful 1-2 punch. You know, this happened in my case. When I was on the therapy, I had a diagnostic lab come back, and the doctor said, well, this lab has to be wrong. It couldn't be right, because what's the lab is saying is that the bacteria is now sensitive to levaquin, where it wasn't. It was resistant before, and they couldn't understand that. It didn't make any sense to them. I said, well, let me help you understand why that's happened, because I'm on phage therapy now. That's something that can happen. Antibiotics can regain their power again. But something was still missing for me at that point before I started phage therapy. I wasn't ready to pull the trigger on it. And I'll tell you why. Something was holding me back. It was that I didn't have the trust, and this is what I want everyone to take away from this conversation that we're having today, is that I didn't have the trust in the science or in the phage or in the hospitals. I didn't understand, was I just an American who was going to be taken advantage of for his money and given this viral treatment, which may or may not work? Who knows? I can't really get anybody to talk to me. I was still in the dark. But thankfully, I met a man named Pranav Johari. I don't know if you know that name, but he's in India. He had done phage therapy at Eliava about 5 years before I needed it. And he had a successful cure. He was treated there, cured. And he told me his story, and what I learned from him telling me his story, and thank God I met him, because I wouldn't have done the phage therapy if I had not met Pranav, because I had held off up until I met him. He gave me the trust I needed. That's the message I want you to hear today, is that without this trust in phage therapy, it's not going to happen. If we don't have people like myself speaking up, and you don't access people like myself, like you're doing today, so that people outside of this small circle we have of scientists who understand phage and understand its power, we need patients speaking, because I was only willing to take that phage therapy when I talked to Pranav, and he gave me that kind of trust I needed in the phage. What I understood then, after I wanted to do this phage therapy, was that I'm never going to get it in the United States. I was not privileged enough. There are people in the United States who've had it, some with clinical trials and some with some very special privilege. I didn't have that. I knew I was never going to get phage therapy in the United States. There's too many barriers. And I decided that if I was going to do this, I was going to have to travel to Eliava. So I sent my samples over to Eliava. I went through all of this work to get my treatment, custom phage. I knew that I would need a custom phage, right? I knew this bacteria was difficult from the very start. I really kind of knew from the get-go that I would need a custom phage, and that's how it turned out to be. They created a custom phage, took I think it was 10 weeks it took them to make that custom phage. As soon as they told me that it was ready, I hopped on a plane and went to Tbilisi because I wanted to know those folks there. I stayed for a month. I didn't need to really stay for an entire month. They could have done the treatment sooner. But I wanted to know the system. I wanted to know Georgia. I wanted to know Tbilisi and Aliava and the people there, because I knew if it worked, I had to tell this story, because it's not right for me to have the privilege to be able to go there and make this happen and find a cure, and other people can't do that. That's what's wrong with the system. And I wanted to make sure that I told this story. And again, thank you for inviting me to be here. And why aren't we offering this amazing treatment in the United States or globally, really? Well, we have regulatory mismatches. We have a research gap. We stopped studying phage therapy in the 1940s. Now it's really just coming back full force. We have difficulty getting people into clinical trials because we're asking them to ingest a virus, a live virus. And again, it goes back to that trust issue. If you're not willing to trust the science, then you're not going to involve yourself in a clinical trial that asks you to ingest a live virus. And there's an education gap. Our physicians in the United States, and probably similarly globally, don't understand phage therapy. They don't know what it is. I had to educate my own physicians about phage therapy. Our hospitals lack awareness. Our insurance companies lack awareness. We have to teach this phage therapy. If we don't do it, it's not going to happen. In the United States, one of the things we need to do is understand why pharma won't fund it. It's not a profitable medication right now. We need to do things that make phage work for this broken business model. We need to make it work instead of for the business model. We need to make it work for the patient. Instead of always talking about the market, we need to make it work for the patient. One way we can do that in the United States, and there's probably similar kinds of legislation globally, is we need to pass that Pasteur Act. It's been sitting on the legislative floor for 6 years now, and no action has been taken on it. Even if we fund it unfunded, even if we pass it unfunded, that's what needs to happen. And that's why I'm speaking about it all the time to folks. You know the numbers, you've seen these numbers, right? And they're probably much worse than we know, because hospitals are not incentivized to code a patient as having a bacterial infection. That's not something that's going to help a hospital. We need to get these numbers out into the public. And one way we can do that is to stop saying the words AMR. I understand that in the science community, we get that. But the civilian population, when they hear the letters AMR, antimicrobial resistance, they turn off. I'm talking about it in terms now of hard to treat infections, because as a civilian, someone who's not a scientist, I understand that. At least I know it's difficult to do whatever I need done to this infection. It's hard to treat. Antimicrobial resistance makes no sense to me, and I turn off. That's something we need to hit head on. What will it take? We have a roadmap that I've created that I think will help us get to actual clinical use of phage therapy. Number one, it's regulatory reform. We have to have regulatory reform. We need then public funding. Phage therapy, I don't believe, is going to happen at a clinical level until we have public funding. I don't think Big Pharma wants to get involved. We do have some involvement, but not enough to make it happen at a clinical level. We've got to get our governments to fund this, to understand the dire necessity to do something about these hard to treat infections, which are causing mass deaths, and it's only going to increase. We need to pass that Pasteur Act in the United States. We need clinical education, dire need for clinical education. Our doctors need to know what it is. Our hospital, healthcare facilities need to know what phage therapy is, and our insurance companies need to know what phage is. Everybody has a reason to use phage therapy. They just don't know it yet. And most important, and this again is the message that I want you to take away from this, is that patient advocates, and I'm the only one I know out there really speaking loudly about it right now. We need more, and we need people to hear it. If you're a scientist, if you're a pharma, if you're a researcher, and you want phage therapy to happen, those people who are going to take phage therapy, they need to hear my voice. They need to hear other patients' voice. They need to hear Pranav's voice. They need to hear about people who have taken it so that we can build trust, because I guarantee you the same kind of disinformation that's hitting vaccines, you see it all over social media right now in the United States. It's a catastrophe right now. We have measles outbreaks. We have screwworm outbreaks because there's all this disinformation out there on social media and the internet. We have to hit that head on with people who have used phage therapy and can tell others that it works, that it's real, and it's a friendly virus. Why do we have this? It's a friendly virus. And lastly, that's why I wrote this book. And that's why I started Phage One Voice, is so that we can kind of unite our voices in an effort to tell the world about phage therapy and what it can do for our world to help us end this hard to treat infection crisis that we have today. And I want to thank you today for letting me speak. I really appreciate the opportunity.
Thank you so much, Christopher. And it's really inspiring to see like how you've been throughout. And especially for all the Phages parents, I would highly encourage to read this Finding Facebook if you're really interested to know the journey of the Chris, how he has been through.